Last one.
Yeah, what else?
This is a sad one. I hate reporting on these because it's just, I hate talking about when bad things happen to people, but there's things to be learned from it, and that's why we do it. So
there you go.
Yeah. So it's a really sad story that unfortunately is a recurrent theme on the show. This is about a UK mom who died after plastic surgery while in Costa Rica. Yeah, so this is a 45-year-old woman named Regina Kerr, who is a UK citizen. It didn't say if she's from England or Scotland or... UK is like all of them, right? Like that's Wales, Scotland. Is that Ireland too?
Yes. Why not?
Okay.
I have some friends that are going to call me. But
I know it's
yes.
all of it. Because I figured if she was British, they would have said British. But I don't know. All right, she's from the UK. All right. Maybe some European people can clue me in on that. All right, so she's from the UK. She's living in Costa Rica where she's a teacher. She's at a bilingual school where she's teaching English to, they speak Spanish in Costa Rica from what I understand. And unfortunately, she passed away last week. And this was one day after getting plastic surgery. Now,
wow.
You said last week?
Yeah, it's just happened.
Oh my goodness.
This literally just happened, like less than a week ago. So reportedly she had liposuction of her arms, a tummy tuck, and fat grafting, okay? All right, so we gotta remember those three things. Other details are pretty sparse. There was no basically explanation of the cause of death, just that she had a medical emergency at a aesthetic clinic is how they termed it. We'll come back to that. Was transferred to the hospital and she unfortunately passed away. All right, so what could have happened to this poor lady? Because, I mean, I do think it's important that people understand what the risks are because, again, this is a recurrent theme on the show where people are going out of the country, they're having certain types of operations, and they're either getting killed or maimed or botched or however you want to talk about it. So what are the possible causes? Well, it said she had fat grafting. And so if she had fat grafting, there's a very high possibility. I'm gonna quiz you, Brenna, and if you don't get it right, don't feel bad because you're still pretty new. If she had fat grafting, what maybe did she have?
Wait, what? Repeat the second part?
If she had fat grafting, what surgery that I don't like did she maybe have?
Oh.
It's okay if you don't know. Just be like, I'm not 100%.
I'm blanking, like I've heard
Starts with a B,
Robert
ends
knows
with an
BBL.
L.
That's right.
Okay.
Yeah, very good. I'm not putting you on the spot. I felt like
I was thinking that. I was like, I feel like that'd be too obvious. But then,
Yeah.
I can't second guess myself.
That's right. So so if she had fat grafting, realistically, that's one of three operations. Most likely, it's a Brazilian butt lift, which I absolutely hate these surgeries. I will not do them. I even will talk down to surgeons that do them openly. So it's either Brazilian butt lift. It could have been fat grafting the breast. That's a possibility. Okay, it's possible. It could have been fat grafting in the face. That's also a thing.
Right.
Most likely Brazilian butt lift. Okay, so if she had a Brazilian butt lift, then the potential cause of her medical emergency is most likely fat embolism, which is the reason the mortality rate of Brazilian butt lifts are so high. So what that is fat grafting. For those who are not familiar, you harvest fat via liposuction. Typically you process it, make it a little bit more easy to inject. Then you inject it into another area. Fat embolism is when that fat gets injected not into other fat tissue where it's supposed to go, but gets injected into a blood vessel. And if you get fat globules in a blood vessel, that is a medical emergency that 100% can kill you. And that is the most common cause of death after Brazilian butt lift, and it's actually not very low.
So basically what you do, or what one does, not you, with a fat graft, so do you do any fat grafts? Mm-hmm. Okay.
I'll do breast and I'll do face.
Yeah,
and so ask me, why do I do that and not the butt?
It's safer.
Yeah, I mean, it is. Like the issue with the butt.
Results.
The issue with the butt, I mean, there's more than one issue, but the reason that the fat embolism ratio risk is so high with Brazilian butt lift is there's a lot bigger blood vessels in the butt. I mean, that's the bottom line. There's some huge blood vessels in there. You're using a cannula that's, I use a Coleman injector, which is probably, I mean, you guys probably can't see this on the camera. It's probably like an 1/18 of an inch. It's about the size of an 18 gauge needle, which is what that means, an 1/18 of an inch. Except it's blunt, but there's blood vessels big enough that especially if you're not using good technique, which, man, I hate to say this because it's going to come off bad, but I'm going to say it anyway, that I I think a lot of really high quality surgeons are not doing Brazilian butt lifts, if that makes sense, which
Yeah.
means maybe
It does make sense.
the ones that are doing it are maybe not as technically skilled.
Well, follow
I
the
don't know.
money.
I mean, there's a lot of people that don't do them. There's a lot of, and some people don't want to talk about it. Like there are plastic surgeons like, oh, I don't want to weigh in. I mean, I'll weigh in. Like I think it's a bad surgery. I think if you're doing them, if you're really skilled, you'll probably be fine. But there's always that risk, right?
Absolutely.
And there's other issues. It's not just the death. I mean, to me, that's the big one. But there's other downsides to it. And so all of it together, I don't like them. And I really derailed my own conversation. What was I talking about?
So how it
breath.
happens? So you go take
right. I was like,
you,
why did I-
you go
how did I
take the
get
fat,
here?
you process,
Yeah, you process it,
it,
you re-inject
and then
it.
you're re-injecting it.
Yeah.
So the other thing, I mean, this is just common sense for me.
Yeah,
You know,
bring
if
it.
you're doing it in the face or the breast, and you know, versus my butt is a lot bigger than
Right,
anything
that's-
else, and I'm not getting any of those. Mine, obviously.
That's
but,
a secondary reason I don't like it is
so
because you
you're
need
doing
so much
a lot
fat.
more.
Yeah, you're doing a lot more. Yeah,
So
100%.
the more you do, the more risk.
The more risk, yeah,
The bigger,
100%.
yeah. So that
Bigger
makes
blood
sense.
vessels, more injection, true. I actually like it for the breast, and I've done a lot more fat transfers to the breast. But like for breast, I might inject, I think the last one I did, I injected like 120 cc's per side.
Yeah.
It's not a lot. For butt, you're generally trying to inject, 500, 750, 1,000.
So you're doing like 4 times as
At
much?
least. Yeah, you're doing a lot
yeah,
more.
5
Yeah.
times as much.
Yeah.
You know,
a lot.
more risk.
So anyway, fat embolism, definitely high up on the list. Without question, the most likely culprit. All right, what's another potential culprit? Well, I think second on the list would be an anesthetic complication. And that could be one of two things. If they did this in like an office clinic, it is possible she had this done under local anesthesia. And it is not uncommon for people who get large surgeries under local anesthesia to get lidocaine toxicity, which will cause you to go into cardiac arrest. I'd say we do probably 2 or 3 stories a year on the show, just in the United States, about people who died from local anesthetic toxicity. And there's probably plenty that we miss.
So, time out. Let's
it.
go back to doing just the face or breast. Can you do those local? How do you typically do them?
So I will do minor procedures under local, but they have to be minor, like really minor. The biggest thing I'll do in the office under local is like what I call spot lipo. So spot lipo is not, I want to lipo my whole stomach and my hips and all this.
Right,
It's
right.
like I got one small area that bugs me, that's really a small area, maybe something the size of my palm.
Okay.
And if it's that small, and if I think the patient can tolerate getting the injections, it's not unsafe to do lipo in the office, but it does open up like a whole new can of worms. Things like you have to be super cognizant about how much anesthetic you're giving. And so I usually will only do like less than 50% of like what's considered like a max dose.
Right.
Like way so far under it that like I don't have any like concerns about where.
So if you're somewhere and they're going, yeah, sure, we can do that in the office, no big deal.
It just depends on what it is.
Those should be red flags.
If it's a
based
scar
on-
revision or something small, sure.
Okay.
If it's real surgery that they're wanting to do under local, then
Yeah.
you should run away. It's like, why are they doing it like that? Is it because they can't
Yep.
get an anesthesiologist to work with them? Maybe. I mean,
Because in a surgery center, you would have that
You'd have that.
anesthesiologist.
yeah,
that
typically
would
you
be-
can do local anesthetic in a surgery center.
Right, right.
But yeah, it is a red flag. Doing large surgery under local anesthesia is a super bad idea. Go back to the liposuction. For example, if I'm doing, and this is the third potential complication
Right.
that I'm going to combine into what we're talking about now. If I'm doing liposuction of the abdomen, I don't want people tensing up where they're, like if you tense up, like in your abdominal wall, like bulges forward, like you can literally punch right through it. And so
Yeah,
what
in the
happens
middle
when
of
you're doing
surgery.
things under local, it's like, oh, okay, they're numb here, and then you get to a spot where they're not numb, and then they jump while you're jabbing them with a metal rod.
It's happened to me, like with the dentist, and he's like, "Ooh, hold on, let me give you
Okay,
a little
exactly-
bit more."
exactly right.
So you just wince, but
you're moving when someone is
Exactly.
like doing something that's potentially dangerous around you.
absolutely.
So, and I've had that happen even just doing spot lipo where somebody jumped. I'm like, whoa, okay, sorry about that, but we got to numb you up. We can't have you moving. Like it's making this less safe, right?
Absolutely.
So, and that's when I'm doing something tiny. When you're doing a big surgery, like, I mean, these guys are crazy. They're absolutely crazy. There's just no reason to put someone under that risk. Like, you can't tell me that the risk is less to do it under local. It is more. You know, there is risk from general surgery, but like nowadays that risk is like the same as if you're driving from your house to the surgery center.
Well, and
is there a risk of driving and getting in a car crash? Sure, but it's like nothing.
And I've seen some of those TV shows where they investigate this, and some of these doctors that are working out of a center are doing, you know,
tummy tucks under local or something
and
stupid.
15
like
hours of surgery that,
Yeah. Oh,
you
it's
know,
absolutely
this
bonkers.
takes 8 hours, this one takes, so he did how many?
Yeah.
Oh, well, you know somebody else is doing that's
And
not
the research,
trained. And
the research clearly shows that the mortality rate starts to jump up the more surgeries you add on, specifically for aesthetic stuff.
Yeah.
You know, again, I think that that's a self-limiting kind of data point because like I put a hard cap on like 2 procedures. You want your tummy done, you want your breast done, fine. You want your tummy's breast and arm? No way. Like, I'm not doing it. Like, I don't care how much money you offer me. I'm not going to do that. Like, it's just too much. It's not safe. It opens up more risk. And I'm not going to do it. Whereas other people are like, yeah, sure, I'll take your money. Why not?
Yeah, it's like the mechanic. No, we need to wait on that one. So you're saying you would do maybe 2 things at a time.
At a time.
So
and
they
then
would
I
come
literally
back
make
maybe
people wait. Like, I tell
3
people,
months, 6 months.
it depends on what they're having
what it
done.
is,
But like,
how
you know,
they-
it's like say someone did like, and I have this happen all the time where I come in and somebody's like, look, I want to do my, like say they had a lot of weight loss. Like I want to do my arms, I want to do my thighs, I want to do my tummy, I want to do my breasts.
Get it all done at once. Makes
I'm
sense.
like, absolutely no. It's like, you can pick 2, pick your favorite 2. We'll do that. Then we're going to wait at least a couple months for you to completely heal up, make sure you're doing great, and then you can jump back in if you want. And people do it because I'm like, look, I'm not going to do all this at once because it's not safe. And people like that because they know that I'm like basically turning down money, right? I'm like, look, I'm not going to do that, right?
Good.
So so anesthetic the other one I kind of said I was going to mention, I didn't, but is like the perforation. Like there are documented cases, even within the United States, of people doing liposuction and they get in the wrong plane and they puncture the liver. There's been reports of people puncturing the heart with a lipocannula, and that could be it. I think that's much less likely, although it is a possibility. All right, what about the doctor facility? Well, there was really no details, except that they did say it was at a private clinic. I don't like that. I don't like surgery like that done in an office setting. I will say there are some excellent surgeons in the United States that have their own personal ORs that are very, very safe. But there is that absence of oversight and regulation. If I want to do something in the surgery center that's not safe, someone's going to call me out on it. They're not going to just let me do it. You know, they're not going to let me not call 911 or initiate a code if a patient's having.
It's kind of like meeting somebody in public, you know.
Right, there's people around. Like you're not going to try and do something shady.
Yeah.
You know, because if it's your private clinic, you know, operating theater or whatever, the people in there work for you. Like you have control over them. Versus in the OR, nobody there works for me.
There's no
anesthesia is
oversight.
independent. The circulating nurse is independent, and the scrub is independent. So like, if I'm going to do something, you know, totally stupid, they're going to like sound an alarm, and they're not going to let me do it. You don't have oversight like that in a private clinic. You know, also like, you know, as far as sterility and all that, where there's regulation, none of that exists.
Yeah.
So
exactly.
So there was a lot that that happened here that I didn't like. You know, I kind of call it the trifecta of serious plastic surgery risk, which is medical tourism, getting a Brazilian butt lift, and you know, big surgery in an office-based setting.
Yeah.
And you know, it's like, you know, when you start adding risk, I mean, eventually it catches up to you, right? If you do one thing that's risky, okay, maybe get away with it. But when you start stacking these risks, I mean, eventually you're making it to where it's, you know, it goes from extremely unlikely to, hey, this is a possibility, and then something happens.
Right. Yeah. No. Absolutely. It's one of those things, you get what you pay for, and you know, I wouldn't say in medicine cheaper is always better. You don't want to go for.
Yeah. You don't want to like your surgeon to be like the one that's the lowest bidder. I mean.
Yeah. Exactly.
Especially when there's no regulation of like who's doing what.
Yep. Yep.
You know,
and there's enough out there. Surely, you know, you ask. Hopefully, I don't know, do you have patients that'll ask about risk and, hey, what's the risk in this, or what, you know, what
when
can
I do
happen?
a consult, that's part of my consult. It's like, these are the risks that I see. I'll even break down like how many I've seen. Because for a
So
lot
before they even ask, you're telling them,
Yeah.
hey, these are the issues that could come up.
So when I do a consult, I basically give an overview of the procedure, my general thoughts on it, how many I do, technically how it's done, any things you need to think about before you do it. So for example, if it's like, say, augmentation, like, okay, what size do you want to be? How the procedure's done, what's the recovery like, what are the instructions, and then
Right.
what are the risks?
Right.
And that's for every surgery I do, I go through all that. It takes about 30 minutes,
Yeah.
But at the end of it, patients are like, geez, thanks, that was actually super informative. I feel like I kind of actually know what
Yeah.
this is about.
You're answering questions they didn't know they had.
Right, yeah. So.